and I'm the medical fellow of the ERN-EYE.
What is your concrete role in the ERN-EYE network?
So in the ERN-EYE network, I am part of the help desk team with our IT specialist. So we are two. We are helping the users with the CPMS, or the virtual clinic, or the clinical patient management system. So the IT specialist is more involved with technical issues like logging on to the system and creating a new panel, and I'm helping the users with our ophthalmological data set, which is quite thorough. And if needed, I can also approach different members individually to ask them to participate in a concrete panel according to their expertise or the research that they have done.
In your opinion, what is the most important issue ERN-EYE could overcome?
So, of course, the ERN-EYE has many technical issues that needs to be overcome. For example, getting enough users to the CPMS, which is quite a good system. It is a very thorough one, and it seems to be complicated at a glance, but it really isn't if you get used to it. But the real question is how to really kickstart the CPMS. We have quite many users, but we don't have that many panels as we should actually, because there are many questions I'm sure in every center of expertise that could be asked for their patients. But really, CPMS is not necessarily used as a part of a patient management right now. What it should be actually, it should be the last instance where you get help for your patient.
What are the main challenges for the network?
So the main challenges for the network, I think, one of the challenges is already overcome. So as I said about virtual clinic, this is already working well actually in practice. But we have also the rare eye disease registry that needs to be created, as well as the guidelines. And I see a lot of people, a lot of experts working like really hard on that every day, and also this team in Strasbourg. But we have still very limited time to make this registry and to create those guidelines, and I'm afraid that the time might be too limited to be on the schedule. Okay, and the best advances of the network? I think the best advantages of the ERN-EYE network is that we can work together. Really, that the major experts of Europe can work together, and anything that we create, like the guidelines that they are created within the network, are really thought through and consensual. In your dreams, what would ERN-EYE look like in 10 years? So in 10 years, I think the CPMS could be already a part of a clinical practice really automatically. And I think at this time we should already be seeing the real cost effectiveness of the system. And what is more, I think the registry of rare eye diseases would be ready at this time, and should be used all over Europe. So we would have a really clear idea what is going on with rare eye diseases in Europe. In addition to this, I think we would have many guidelines already in 10 years, so it would help the doctors to make decisions for their patients who are dealing with the rare eye diseases.
Thank you very much.
You're welcome.